Namaskar. The centre has sanctioned 15,000 crore rupees for India COVID-19 emergency response and health systems preparedness package. 7,774 crore rupees will be utilized for immediate COVID-19 emergency response and the rest for medium-term support of 1 to 4 years under mission mode. Today, a 62-year-old doctor who was a general physician died from the coronavirus in Indore. We salute this Corona warrior and all doctors, nurses and other healthcare workers who are in the front line, our frontline warriors. And our focus is on the attitude of service before self. It's also about the imperative need of sealing of hotspots to prevent the virus from community spreading. Let's begin with the headlines. I'm Mark Lynn. In a big boost to the states in the fight against coronavirus, the centre has approved COVID-19 emergency response and health system preparedness package. 100% financial aid economic package will help the states procure essential medical equipment and medicines. 15,000 crore rupees to be given in 3 phases from January 2020 to March 2024. GRM on COVID-19 discusses issues of masks, ventilators and separate dedicated COVID hospitals. The centre says no shortage of personal protective equipment. 20 companies are manufacturing PPEs. 49,000 ventilators being procured. The number of coronavirus cases in India goes up to 5,218. 169 people have lost their lives due to the pandemic so far. 477 people have been discharged after successful treatment, and the centre has dispatched 10 high-level teams to 9 states to enhance cooperation. The police is maintaining a strict vigil in sealed areas of Delhi and Uttar Pradesh. Movement of people has been stopped. Authorities have ensured door-to-door delivery of essential items in such areas. Delhi government is running Operation Shield in hotspot areas. Number of new cases rises rapidly in Maharashtra and Madhya Pradesh. Maharashtra has the highest count of COVID-19 patients. The death of corona-infected doctor in Indore, Madhya Pradesh. Odisha extends the duration of the lockdown till April 30. Many states make wearing a face mask mandatory. Prime Minister Narendra Modi's efforts to collaborate with countries around the world on COVID-19 continues, and the Prime Minister talks over the phone with the President of South Korea and discusses the challenges of COVID-19. The US President Donald Trump and the Brazilian President express their gratitude. The Prime Minister replies that India shall do everything possible to help humanity's fight against COVID-19. The war against the coronavirus continues in the world. About 1.5 million people have been infected so far, and more than 88,000 people have died. The US, Italy and Spain have the highest number of deaths, and 100 doctors have died in Italy. Our top story: the centre has approved a comprehensive package to provide assistance to the states in the fight against COVID-19 pandemic. COVID-19 emergency response and health system preparedness package, the 100% centrally funded scheme, is aimed at enhancing the infrastructure in states to meet the coronavirus epidemic challenge. This package was called the India COVID-19 Emergency Response and Health System Preparedness Package. And under it, the Government of India has sanctioned 15,000 crore rupees for India COVID Emergency Response and Health System Preparedness Package. Of the funds sanctioned, 7,774 crore rupees will be utilized for immediate COVID-19 emergency response, and the rest for medium-term support. The project will be implemented in 3 phases. Phase 1 will be from January 2020 to June 2020, and Phase 2 will be from July 2020 to March 2021. Phase 3 from April 21 to March 2024. The key objectives include mounting emergency response to slow and limit COVID-19 through development of diagnostics and COVID-19 dedicated treatment facilities, So we can see that the project is implemented in 3 phases. The key objectives as we are reading out. So let's move on then. This is one of the key objectives, mounting emergency response fund. Also, centralized procurement of essential medical equipments and drugs are required for treatment of infected patients. Strengthening and building resilient national and state health systems to support prevention and preparedness for future disease outbreaks. Setting up of laboratories and bolstering of surveillance activities, biosecurity preparedness, pandemic research, proactively engaging with communities and conducting risk communication activities. The Prime Minister, in his address on to the nation on the 24th of March, had highlighted that the central government has provisioned 15,000 crore rupees for treating coronavirus patients and strengthening the medical infrastructure of the country.
अब कोरोना के मरीजों के इलाज के लिए देश के हेल्थ इंफ्रास्ट्रक्चर को और मजबूत बनाने के लिए केंद्र सरकार ने आज 15,000 करोड़ रुपए का प्रावधान किया है। इससे कोरोना से जुड़ी टेस्टिंग फैसिलिटीज, पर्सनल प्रोटेक्टिव इक्विपमेंट्स, आइसोलेशन बेड्स, आईसीयू बेड्स, वेंटिलेटर्स और अन्य जरूरी साधनों की संख्या तेजी से बढ़ाई जाएगी। साथ ही मेडिकल और पैरामेडिकल मैन पावर की ट्रेनिंग का काम भी किया जाएगा। मैंने राज्य सरकारों से अनुरोध किया है कि इस समय सभी राज्यों की पहली प्राथमिकता सिर्फ और सिर्फ स्वास्थ्य सेवाएं ही होनी चाहिए, हेल्थ केयर ही प्राथमिकता होनी चाहिए।
Now, as of date, a total of 223 labs comprising a network of 157 government and 66 private laboratories are conducting rigorous screening process. Furthermore, the Ministry of Health and Family Welfare has already disbursed 4,113 crore rupees to the states and union territories for dealing with the emergency COVID response fund. Now, the centre has also prepared teams to coordinate with the states on crucial aspects of logistics and infrastructure support in the fight against COVID-19. The government has also said that supplies of PPEs, masks and ventilators have now begun. 20 domestic manufacturers in India have been roped in to make the PPEs, and orders for 1.7 crore PPEs have been placed. Also, according to the centre, the supplies have already begun. Apart from that, the government has also placed orders for 49,000 ventilators. The government has also said that there is no need to panic as far as the availability of essential equipment is concerned. Now, the number of active COVID-19 cases in the country has risen to 5,218. This is according to the Ministry of Health and Family Welfare. 169 people have lost their lives to the disease, and as many as 477 people have been cured and discharged, and 1 has migrated. Well, a high-level meeting of the group of ministers on COVID-19 was held in New Delhi under the chairmanship of Dr. Hydroxychloroquine, the Union Minister for Health and Family Welfare. So a group of ministers had detailed deliberations on containment and management of COVID-19. The GOM also discussed actions taken so far, the current status of social distancing measures as a preventive strategy, and the stringent actions taken by the centre as well as the states to contain the spread of COVID-19. Several other measures about strengthening capacity of the states, including devoting adequate resources for creating dedicated COVID-19 hospitals, equipping the medical institutes with PPEs, ventilators and other essential equipment, were also discussed in detail. The states have been asked to identify COVID-19 centres, hospitals, according to the already laid down guidelines. The GOM also reviewed the testing strategy and availability of testing kits across the country, along with the strategy for hotspots and cluster management. The GOM was apprised of the situation regarding the adequacy and availability of PPEs, masks, also ventilators, drugs and other essential equipment against the requirements. The GOM was informed that domestic manufacturers have been identified and production of PPEs and orders have been placed. In addition, the order for ventilators has been placed. The GOM has been briefed about the number of public and private labs that are presently testing for COVID-19, along with the number of tests that are being conducted every day through the network of labs. The GOM will also review the status of the implementation of the Pradhan Mantri Garib Kalyan Yojana. The GOM expressed satisfaction over the work done by the ministries and the empowered groups. The Delhi Chief Minister Arvind Kejriwal has warned of strict action against those misbehaving with healthcare personnel. 20 areas have been identified as containment zones in the national capital, and people are not being allowed to enter or exit these areas.
Delhi Chief Minister Arvind Kejriwal on Thursday warned of strict action against those misbehaving with healthcare personnel in the city in the wake of coronavirus outbreak. Kejriwal said 21 areas had been identified as containment zones in the national capital and people were not being allowed to enter or exit these areas.
S का मतलब सील कर दिया, तो शील्ड का H का मतलब होम क्वारंटाइन कर दिया, I का मतलब आइसोलेशन एंड ट्रेसिंग, E का मतलब एसेंशियल सप्लाई, L का मतलब है लोकल सैनिटाइजेशन और D का मतलब है डोर टू डोर चेकिंग की जाती है.
Himachal Pradesh has said that all the cases in the state are related to Tablighi Jamaat members and efforts are on to ensure that all those who exhibit symptoms will be tested.
अभी तक हिमाचल प्रदेश में हमने 50 लाख का जो है एक्टिव केस फाइंडिंग का प्रोसेस कंप्लीट कर लिया है. जो जितने भी मामले इस प्रकार के थोड़ा से भी दिखते हैं, सिम्टोमेटिकली दिखते हैं, उसमें आशा वर्कर जा रही है, आंगनबाड़ी वर्कर जा रहे हैं, हमारे मेडिकल डिपार्टमेंट के हमारे हेल्थ वर्कर्स जा रहे हैं और ये पूरे प्रदेश भर में चला है. तो ऐसे में कह सकता हूं कि हमने बहुत गंभीरता से सारे विषय को लिया है.
Uttar Pradesh has decided to seal the hotspot areas in the state. Administration has assured of uninterrupted supply of essentials in the sealed areas.
हॉटस्पॉट्स के क्षेत्र में आवश्यक वस्तुओं के डोर टू डोर डिलीवरी के लिए दूध, राशन, फल सब्जी की व्यवस्था के लिए भी अलग से समीक्षा करने का निर्देश उन्होंने वरिष्ठ अधिकारियों को दिया है. इसके साथ साथ हॉटस्पॉट्स के क्षेत्र में PRV 112 यानी UP 112 की गाड़ियों को भी स्टेशन किया जाएगा.
The Odisha government has decided to extend the ongoing lockdown in the state till April 30 to effectively contain the spread of coronavirus. Schools and other educational institutions will remain closed till June 17, Chief Minister Naveen Patnaik announced after a video conference with his ministers. Patnaik said the state has also urged the centre to stop train and flight services to Odisha till April 30.
उड़ीसा सरकार ने घोषणा की है, राज्य में लॉकडाउन अप्रैल 30 तक एक्सटेंड किया जा रहा है और सभी स्कूल्स और कॉलेजेस जून 17 तक बंद रखा जाएंगे. इस डिसीजन की पालन करने के लिए भारतीय जनता पार्टी हर किस्म की सहयोग करेगी और हम जनता को अपील करते हैं कि सरकार की सभी नियम, कानून और गाइडलाइंस को जरूर फॉलो करें.
A 62-year-old doctor who had tested positive for coronavirus died in Indore on Thursday. Dr. Praveen Jadia said that the victim, who was a general physician, breathed his last at a private hospital in the morning. Authorities on Wednesday sealed Indore, Bhopal and Ujjain districts to control the spread of coronavirus.
18 जिले अब तक मध्य प्रदेश में संक्रमित हो गए हैं. मैंने 3 जिले, 3 शहर महानगर, इंदौर, भोपाल, उज्जैन को पूरी तरह से सील करने के निर्देश दिए हैं. इन शहरों में ना कोई अंदर जाएगा, ना इनसे कोई बाहर जाएगा. ये व्यवस्था पूरी कड़ाई के साथ हम लागू करेंगे.
Wearing mask has been made compulsory in the cities like Mumbai, Pune, Nasik and Nagpur, where coronavirus has spread on a big scale, Maharashtra Minister Anil Deshmukh said on Thursday. He also urged the residents of these cities not to step out of their homes without covering their mouths. Haryana government has said that the salary of all those who are fighting the COVID-19 disease will be doubled.
कि जब तक ये कोरोना इसका पीरियड चलेगा तब तक ये सारा स्टाफ जो सीधा कोरोना के पीड़ित मरीजों की कोविड की एक इलाज में लगे हैं या उनके संभालने में लगे हैं, इनकी सैलरी अब डबल रहेगी.
All the state government are working cohesively to fight the COVID-19 menace to ensure that the nation wins the fight. Bureau Report, DD India.
Well, the national capital has 669 active cases of coronavirus. 20 hotspots in Delhi have been sealed, and 22 places in the neighboring Gautam Budh Nagar or Noida were also sealed. So the main purpose of sealing is to arrest the transmission of the virus through quarantining an entire area, in a sense, and it also helps the authorities to go house to house and do an evaluation of the virus in a potential cluster.
With the number of cases of COVID-19 still increasing, the government has adopted a cluster control containment strategy. Steps are being taken to prevent the spread of the virus by sealing off identified hotspots. 20 such hotspots in Delhi were sealed on Wednesday. Similar measures were taken in 15 districts of Uttar Pradesh. Apart from sealing 20 hotspots in Delhi, the government has made it mandatory to wear masks while outside one's home. People in the sealed areas are not permitted to leave their homes at all, and essential supplies will be supplied to their homes. Streets and roads were deserted as people complied with the stricter lockdown. Delhi government is ensuring supply of essential items.
आप अगर इसको लॉकडाउन को फॉलो नहीं करेंगे तो फिर बढ़ेगा और ज़्यादा दिक्कत आएंगी. अभी देखिएगा ये बहुत ही डिस्ट्रेस सिचुएशन है, इमरजेंसी टाइप सिचुएशन है कि हमारे को अपनी सारी मूवमेंट को कर्टेल करने की ज़रूरत है. अगर आपको बहुत ज़रूरी सामान लेने जाना है तो दिन में एक बार ही जाइएगा और सारा सामान इकट्ठा लिएगा, बार-बार ना जाएं.
Among the 15 districts in Uttar Pradesh, 22 specific places in Gautam Budh Nagar or Noida were declared hotspots and sealed. Sealing means movement within these 22 hotspots is completely restricted, with no one allowed inside or outside. The administration is sanitizing the hotspots. The fire department has also been roped in to assist in sanitizing the area. Supply of essential items is the only form of movement allowed in the areas. Government employees and local volunteers are assisting in supply of milk and vegetables directly to people's homes. District Magistrate and Police Commissioner have been visiting the hotspots to take stock of the arrangements themselves.
लॉकडाउन की प्रक्रिया को सफल बनाने के लिए आपका सहयोग ज़रूरत है और ये आप ही के लिए किया जा रहा है, आपकी वेलफेयर के लिए किया जा रहा है और प्रशासन इस बात को समझ रही है कि थोड़ा बहुत असुविधा हो रही है, बट कोशिश यही की जा रही है कि आपके घर तक, आपके सोसाइटी तक दूध, फल, सब्जी, ग्रोसरी सब पहुंचाई जा रही है, दवा पहुंचाई जा रही है, आपको कोई तकलीफ ना हो.
जो इंटीग्रेटेड हमारा कंट्रोल रूम है उस पे डेली रिक्वायरमेंट्स के बारे में है और कुछ लोग हैं जो थोड़ा सा भी आत्म संयम नहीं दिखा पा रहे हैं, वो किसी तरह से पास लेने के बारे में बात कर रहे हैं. उनसे मैं अपील करना चाहूँगा कि जन स्वास्थ्य से जुड़ा हुआ ये मामला है, कृपया आप जहाँ हैं वहीं रहिए और आपकी सारी जो आवश्यकता है उनको वहीं पूरा किया जाएगा.
The administration is using drones to monitor any unauthorized movement in the sealed hotspots in Meerut.
वर्तमान में एडमिनिस्ट्रेशन द्वारा 12 हॉटस्पॉट चिन्हित करके उनको पूर्ण रूप से सील किया गया है. उसमें आम पब्लिक का मूवमेंट पूर्ण रूप से प्रतिबंधित है, कोई भी घर से नहीं निकलेगा. जहाँ तक एसेंशियल सप्लाईज़ की ज़रूरत है वो हम लोग इंश्योर करेंगे, डोर स्टेप डिलीवरी. मेडिकल इमरजेंसी अगर कोई होती है तो उसको हमारी एम्बुलेंस उसको अटेंड करेगी, वो आपको खुद घर से बाहर निकलने के लिए ज़रूरत नहीं है.
Strict action will be taken against any person violating the sealing orders. The government on its part is taking these measures in the larger interest of the community and seeks the cooperation of everyone. With Rajiv Rastogi from Delhi, Arvind from Noida and Anuj Yadav from Meerut, Bureau Report, DD India.
Well, today is observed as Shaurya Divas to honor the valor of the Central Reserve Police Force. President Ramnath Kovind, Prime Minister Narendra Modi and Home Minister Amit Shah extended their wishes, remembering the courage of the force, and they paid tributes to martyrs on the occasion.
The whole country is celebrating Shaurya Divas to commemorate the defense of the Sardar post by the Central Reserve Police Force in the run of Kutch at the onset of the Indo-Pak War of 1965. The historic day was 9th April 1965 when the Pakistan Army carried out the Desert Hawk operation to capture Indian territory bordering Pakistan. On the intervening night of 8th April and 9th April in 1965, a whole infantry brigade of Pakistan attacked the Sardar post. 2 companies of the 2nd Corps of CRPF were stationed there. Recalling the bravery of CRPF, President Ramnath Kovind said that the CRPF knights posted in the security of the country with their valor and patriotism wrote a golden history on the Sardar post of Gujarat on 9th April 1965. Congratulations to everyone and tribute to the martyrs of Shaurya Divas, celebrated in memory of that unusual valor and sacrifice. The battle lasted for 12 hours. In the end, the Pakistani army fled the battleground, leaving behind 34 of their men dead, which included 2 officers. Another 4 soldiers were captured alive. On that night, the CRPF lost 6 of its brave soldiers. Ever since, the day is celebrated by the CRPF as Valour Day. This bravery was saluted by Prime Minister Narendra Modi. Appreciating the courage of the force, the PM said, "The courage of CRPF is widely known. On CRPF Valour Day, I salute this brave force and remember the bravery of our CRPF personnel in Gujarat's Sardar Patel post in 1965. The sacrifice of the brave martyrs will never be forgotten." Home Minister Amit Shah has also saluted the bravery of the CRPF on Shaurya Divas. He said, on 9th April 1965 at the Sardar post located in the run of Kutch, Gujarat, a small contingent of the CRPF created history by defeating the enemy army several times larger than them. Congratulations to everyone and salute our brave martyrs of CRPF, a symbol of indomitable courage, valor and sacrifice on Shaurya Divas. The 1965 war was one of the historic wars in the world, in which a small contingent of police force not only forced the huge brigade of the enemy to kneel down, but also drove it out. April 9th is celebrated as Shaurya Divas to honor the unwavering valor and courage of our CRPF soldiers. With Bureau Inputs, Sudhakar Das's report, DD News.
The villagers of Ditla village of Amreli district of Gujarat have scripted new history. The farmers have returned the money they got in PM Kisan Samman Nidhi, and they have given this to the PM Cares Fund to fight coronavirus. Indeed, a great initiative.
गुजरात राज्य के अमरेली डिस्ट्रिक्ट के धारी तहसील के दितला गांव के जो छोटे किसान हैं वो सब किसान ने तय किया है कि देश के प्रधानमंत्री नरेंद्र भाई मोदी कोरोना के सामने जंग लड़ रहे हैं और सारा देश इसके साथ जुड़ा हुआ है। नरेंद्र भाई मोदी ने किसानों के लिए, किसान के हित के लिए जो किसान सम्मान निधि योजना तय की है और किसान के अकाउंट में 2-2 हजार रुपया जब ये भेज रहे हैं, तब ये सब किसान वो वापस भारत सरकार में भेज रहे हैं और किसान ये नरेंद्र भाई मोदी के साथ कोरोना के सामने लड़ने के लिए खड़ा हुआ है।
हमारा गांव के सभी दितला गांव के सभी खेडूतों ने यह तय किया है कि 2-2 हजार रुपया का चेक जो प्रधानमंत्री सेवा निधि के अंतर्गत जो खेडूतों को दिया गया है अप्रैल महीना का हफ्ता, तो वो हम वापस करके सरकार को मदद करना चाहते हो। सरकार ने इस विकट समय में भी हमें 2-2 हजार रुपया सभी खेडूतों को देकर उसने अपनी जिम्मेदारी पूरी की है, पर हमारी भी जिम्मेदारी होती है कि जब सरकार इस महामारी के साथ जुड़ रही है तो उसको सहयोगी बने।
And going back to our top story, which is about COVID warriors, we are now joined on Skype by Dr. Randeep Guleria, who is the director of the All India Institute of Medical Sciences. Thank you very much, Doctor, for being with us. So we are putting into focus really the sacrifice and service of people like you on the front line. It's important, one needs to understand the kind of pressures that doctors go through at a time like this. And the government also is talking now of raising the number of PPEs, with an order of 1.7 crore PPEs have been placed. How important is personal protective equipment for doctors at the front line right now?
So a large number of doctors are now in the front line, and I would say not only doctors but all healthcare workers. Yes. That includes the nursing staff, the residents, and all the other workers who are working in ICUs, in wards, trying to save lives and look after these patients who have COVID-19 and who are infectious and can give the infection to those who are caring for them. So having proper adequate PPE is very important, because those people who are the frontline warriors, especially looking after these patients, need to be protected. There is a lot of fear and worry among these health workers that they may get the infection or they may carry the infection home and give it to their family members. And therefore, I think it's important that PPE be available for everyone, and it's for the people who really need it that it should be provided.
And also, well, I mean, the doctors are constantly in an environment which is, you know, like they're almost in touch with the virus almost on a daily basis. And you did mention about how they go back to their families, and there is the concern that they could spread it, you know, even be asymptomatic carriers at times. Is there a possibility perhaps that, you know, during this period of time that doctors isolate themselves and, you know, concentrate, probably live in a separate enclosure, just focusing on this particular work until it's past?
So a lot of health hospitals, including AIIMS and others, have had created facilities for doctors if they want to stay. This includes hotels and things like that. However, most guidelines don't really recommend that this is required.
Well, Dr. Guleria, we still have you on the line. I hope actually we're getting in another call. It seems that, you know, our panel has got a few things mixed up. Are you still on the line with us?
Can you hear me, please?
Yes, I can. Please go ahead, doctor. Yes, please.
So what I was saying was that we have facilities created, most health centers have facilities created for doctors or healthcare workers who want to stay while they're off and not go back home. But most international guidelines do not recommend that. They would say that you take proper precautions. We have made even facilities that before you go, you change your clothes, you come in, you take off your clothes and wear the hospital scrubs, and you continue to wear them. And before leaving, you have a bath, you clean yourself properly so that you don't carry any viral infection with you. And if you have any symptoms, you immediately report, get yourself tested, and then are isolated or quarantined till the report is available. So a lot of precautions are needed.
Absolutely.
And we need to protect the healthcare workers as much as possible.
Absolutely. I mean, what would we have? What would this fight be? You know, if the front line suddenly gets infected, that's the big concern, isn't it? And then they themselves become patients, and then, you know, the number of people who can attend on them also reduces. So that will be pretty tough indeed. But you know, looking at the requirements and scaling up, that is, you know, we are preparing ourselves for the eventuality, you know, for a worst case scenario. There have been orders placed for 49,000 ventilators. How do you see ourselves in this preparation? Are we, you know, well ahead of the curve in a sense?
So two things are there. One is that we have had time to prepare. Since January, the government has been working on preparing, whether it be testing, whether it be getting equipment, whether it be preparing in terms of training people how to manage these patients, and also creating COVID facilities which are being created all over the country, both in terms of critical care management, hospital with oxygen, and isolation and quarantine facilities. At the same time, there is a lot of contact tracing which has gone on, and I think that has shown its effect, that we still haven't had a large peak as has happened in Italy, Spain, or even in the US. So because of a lot of proactive action taken by the government, we have sort of flattened the curve to some extent. And although the cases are significant each day, there's not a huge rise in cases. They continue to vary between around 500 to about 700, but not more than that over the last few days, which is still acceptable because it doesn't cause a huge strain on the healthcare facilities. But the next step is that at some point in time, there will be an increase in number of cases, and if our hotspots start showing more and more cases. So we need to work on containment in the hotspots so that we don't let these cases go out from the hotspots, and we confine the infection only to the hotspots, and it doesn't go to areas which are currently cold and where there are very few cases. That is the first step that needs to be taken. Simultaneously, we need to prepare for an increased number of cases, whether it be oxygen requirement, whether it be ventilatory requirement, whether it be isolation facilities or ICU beds. And that is being done at a very large scale across the country, so that at a district level, at a state level, and even at a central level, and even in large cities, we are having enough facilities and we need to network, because this outbreak will happen in different parts at a different point in time. So
Yes.
how do we concentrate our health facilities in one hotspot, and once that becomes all right, if another hotspot develops, how do we move our health resources to that? So a lot of that planning in that manner is already going on, and I think we already have a plan in place.
And talking about hotspots itself, Dr. Guleria, now people are quarantined in a sense in these hotspots which have been sealed. And many of them, of course, may not have any symptoms. They may not even have there's no, they are let's hope none of them have the virus at all. But you know, the point is that this is a chance for the government to actually go and do a proper check, because all these people are sealed now, and actually do proper testing and see you know, how what's the extent to which the virus exists in a sort of a closed, clustered environment in that sense. Is that one of the things that can be done when the area is sealed?
Correct, and that is something that has already come out. The ICMR has changed its
Yes.
guidelines and said that in hotspots, if you have someone who has ILI, that is, has some influenza-like illness, you should test that person either with RT-PCR, or if it's the illness is more than 5 to 7 days old, then you can even use the antibody kit, which will give you a result immediately. Also, certain states have already started looking at these hotspots and even testing asymptomatic people. The aim here is to pick up people in those hotspots who are having the illness and isolate them, quarantine them, so that they don't spread it to others. We already know that these are areas where there is a large number of cases, and we need to be able to segregate them so that the disease doesn't spread to other areas and the chain of transmission is stopped. So besides testing, the most important thing is that at a community level, everyone needs to realize the responsibility, especially those in the hotspots.
Right.
Stay in, maintain social distancing, regular hand washing, realize the importance of the lockdown and this total lockdown in these hotspots. Don't take it lightly and go out or try and escape from these areas, because you are actually responsible for containing this infection and not allowing it to spread to other parts of the country. So I think it's a community war that has to be fought by each citizen in our country, realizing his responsibility and thereby not letting this infection spread to other areas and trying to stop that area.
Well, yes, Dr. Guleria, also, you know, with regard to the healthcare workers who are on the front line, and hydroxychloroquine, which was prescribed, you know, as something as preemptive, because I think even in malaria, it's taken to prevent malaria before you get it, in that sense, isn't it? I mean, I'm not very sure, you're the doctor, but in this particular case, it's a drug that, you know, the whole world is talking about right now. And to what extent, you know, is it in a way a pathway to a solution? Is it, I mean, are we seeing proper, you know, evidence that this drug is actually helping in curing this illness?
So there are two drugs. One is chloroquine, which is used for treating malaria, and a variant of chloroquine is hydroxychloroquine, which is the one that we're talking about. And this drug is used predominantly for a lot of immunological disorders also.
Right.
For disorders which cause arthritis, SLE, even for some pulmonary disorders. And this drug has been used for a very long time by a lot of immunologists, pulmonologists, and other internists. And it's a safe drug. People have used it in patients for years. I've used it myself for a number of years without having much of a problem with patients. The evidence that it works, so therefore we know it's a safe drug and it can be used. The second part is, does it work?
Yes.
That the data for that is not that strong right now. The evidence, more evidence is needed, and that's because this is a new virus for which data is still coming in, and we're having a large number of studies being done. There are two studies, one which came from France and the other which came from China, which looked at giving this drug to patients and not healthcare asymptomatic people, which showed that you could decrease the viral load, and there was some improvement. Even hospitalization and severe pneumonia became less. But these were studies which were not that well done in terms of the quality of research, because they were done in a hurry in a pandemic situation. There's also some lab data which suggests that these drugs may be useful. And since there was an urgency and it was felt that these are relatively safe drugs and they may decrease the viral infection in people who are getting exposed, that is healthcare workers or people who come in close contact, it was decided that if we do a risk-benefit analysis, the benefit is more than the risk, and we
Yes.
should prescribe this drug currently. And that policy subsequently has also been adopted by the United States, the US, and even has been approved by the FDA, where they are now looking at giving these drugs, although the evidence is not strong. But you can't wait for evidence in a pandemic.
Sure.
You have to take certain risks, and I think it's a calculated risk which is worth taking.
And talking about mathematics and numbers, then the death rate is globally, except for Italy, has not been that high. The recoveries are much more significant. And so that's a good sign, isn't it, that people are able to get over this illness, though even though some very healthy people have died. So there are certain aberrations in a sense. And not only people who are immunodeficient, who have certain preconditions. So how would you assess, the overall assessment of this virus? Because people panic, I've been reading some reports where people who have been cured of the illness, they thought they were on their deathbed, but they are quite happy to have recovered, and they didn't find that intense, an experience when they went through the whole process. So what do you think? I mean, what should people be? How would you tell people about this virus?
So I think it's very important to look at the data, and the data is out there from China, it's out there now from US and from Italy and Spain. 80% of individuals who will have COVID infection will have a very mild illness, which will just be like a common flu, and they need just mild symptomatic treatment and they will become all right. 15% will have some degree of problem in terms of breathing difficulty, but they will also become all right with oxygen and supportive medicine. It's 5% who will have critical illness and will need to go into the ICU, where a lot of support will be required. So if you look at it from that point of view, almost 90 to 95% of people will become all right without having to go to the ICU. And many of them, more than 80%, will actually become all right without even having to go to the hospital. And we see that in a large number of our own population, that they have the disease, but they really are not hospitalized. They're quarantined, they self-quarantine themselves, they're in an isolation facility, and they become all right. But there are certain populations which are at a higher risk. And what the data shows is that as your age increases, the chance of mortality becomes much low. It's very low mortality in people who are less than 50 years of age. Very, very low. But if you're more than 60 years and you have comorbidities, the graph starts going up in terms of mortality, and it starts becoming more if you're more than 70, and it becomes even further more if you're more than 80. So elderly are at a higher risk. And therefore, in my mind, we need to do two things. One is protect the elderly in terms of making sure that they stay at home, they don't go out, and they take all precautions so that they are not getting infected, because it will lead to higher mortality in them. Secondly, we need to work on strategies of seeing how we can prevent the infection from going into the community, and thereby getting less and less people involved. So the important thing for the public to understand is that by and large, this is a mild illness in majority of people. India's one advantage is that it's a young population, and therefore majority of people are at a younger age group, and that's why the chances are that it will be a mild illness. One final thing, as far as the cases are concerned, when we look at the mortality, we're looking at the number of cases who are tested positive and the number who died. But there are a large number of cases who get a mild illness and are never tested. So the denominator of the number of cases who had COVID is actually much bigger than what we're calculating. So in the long run, if we will do a mathematical modeling, the mortality will even be lower than what we're thinking right now, because we will find by doing the antibody testing that a large number of people who had the illness never got themselves tested and never even knew that they had COVID. It was a mild illness, and therefore actually the mortality will be lower than what we're even thinking of right now.
Dr. Randeep Gulere, thank you very much for joining us here on Newsnight with your analysis and inputs. We will continue with our discussion. Our second discussion also on this, we are going to be joined by Ellen Rao, who's the former DCP of Delhi Police, and we are going to be focusing on our second focus point, which is that sealing is necessary. In fact, sealing is an imperative need. Sealing an imperative need is our second focus point, sealing an imperative need. And Ellen Rao is with us. Why do we need to seal these areas, Mr. Rao? Why do you think it's necessary at this point in time?
Look at this. This area which have been stated to be the hotspot areas.
Yes.
Infection rate in these areas is much than compared to the other places. So these places have been identified by the administration, by the police, so that these areas can be controlled by not allowing people, not any movement of the people can be allowed in this, and the total restriction of movement of people, because the main cause of this disease is that there should not be any contact of people each other, and that can be contained from
Yes,
the
indeed.
spreading to the community. So these hotspot areas are being identified by the administration only because that if we control these hotspot areas to get it spread over in other communities, then it will be very nice, and then these areas will be given special attention by the health department, by the administration, by the police, and particularly in these areas the supply of essential these essential goods also is not is to be supplied by the administration, not the people cannot come out of their houses, and other people also cannot contact them. So because it has been identified that the maximum number of the quarantine people, infected people are in these areas, from these areas. So just with the basic purpose of containing this overall disease, these hotspot areas have been identified, and we request to the public at large that they should cooperate with the administration, cooperate with the police, and abide by the instructions given by the administration.
Right. Right, but Doctor, I beg your pardon, Mr. Rao, actually one of the purposes now is to sanitize those areas as well, which the administration will be doing. The help of the police will be taken also to see that, people don't violate the sealing, that the police will be utilizing drones to monitor in a sense. Also to see that supplies of essential commodities are constantly there, because you can't, people will panic otherwise. So all these things are up to the administration. How will that be facilitated? One would ask that question, because if you've sealed the entire area, the people who are coming in and going out, they are also people who would be potential carriers.
Definitely now the responsibility of the administration and the police becomes more important here, so that there should not be any panic in the locality where these premises have been stated to be sealed. And because the public confidence should also be there, that the public should know that the administration and the police department is there for their help, and in reciprocally the public also should be very sensitive, and they should not also be panicked, and they must know that administration is very much concerned about them, and I think that the administration and police, if they will go with each other in a tandem, then there should not be any problem. In case there is some problem, then there should not be any reason to panic, and with the passage of time, if some essential commodities are not supplied to the concerned people well in time, then they should wait for them, because this is the critical situation. This is not the normal situation. In some critical situation, we have to face some difficulty, definitely. That is but natural. But at the same time, we must be tolerant in our minds, and we should not be so much frustrated about this, and we should cooperate, and the residents of these, particularly of these areas, should cooperate with the administration and the police, and immediately if they require, then there is a toll-free number is there, 112, and they can help, they can call them, and every necessary help will be provided to each and every citizen residing in these hotspot areas. This is the assurance given by the administration, and the police is definitely helping the administration, and they are doing this meticulous job with cooperation of each other. And in this time of crisis, we must be all positive and think that this hard time will also pass through, and it can only be possible then if we are positivity is having in our mind, and we must cooperate with each other, thinking that this is a natural pandemic, and it can be controlled by our joint efforts with commitment and adhering to the instructions given by the administration, and we must follow rules and regulations which have been explained to us.
Indeed.
Through the media and other sources.
Right. Thank you very much, Mr. L.N. Rao, for those inputs. So the government, Mr. L.N. Rao, a former police officer, saying that the police are expecting people to participate, to help in this. They want the community to come, and they seek the cooperation of everyone. Otherwise, this is going to be a very difficult task, especially in these areas which are completely sealed. Now, moving on then to our next story. The Union Territory of Ladakh is not leaving any stone unturned in the fight against COVID-19. Ladakh Lieutenant Governor R.K. Mathur has launched IT-based and web-based applications to track, train and ease the problems of Ladakhis stranded outside the region. An exclusive report from our correspondent Ramesh Chandra from Leh.
In the fight against COVID-19, Ladakh is leading the country in forefront. Ladakh Lieutenant Governor R.K. Mathur has launched certain web platforms to track and train the COVID-19 frontline warriors and patients.
Our aim is to have better quarantine, so that if we quarantine, if we contain, then we will come out of this COVID problem as soon as can be.
With the launch of IT-based applications and websites by Ladakh Lieutenant Governor R.K. Mathur, the Ladakh administration is trying to track, train and ease the problems of Ladakhis stranded across the globe. With Mansoor Shanku, Ramesh Chandra for DD News, Leh.
Well, in the time of this nationwide lockdown, to ensure supply of fresh fruits and vegetables, Mother Dairy's Safal unit has been steadfast in catering to the rising demand in all its 310 outlets in Delhi NCR. It is also being able to ensure that Safal stores maintain social distancing while people are doing their purchases.
With rising demands of fruits and vegetables in the Delhi NCR region, Safal has augmented its supply lines. Now it is being ensured that consumers don't face any inconvenience during the lockdown period. Prior to the lockdown, daily 250 metric tons of fruits and vegetables were supplied to various Safal retail outlets. Now the figure has gone up to 300 metric tons.
फल और सब्जी की आपूर्ति पहले से हमने बढ़ाई है और होम डिलीवरीज भी हो रही है. दूध और फल सब्जी की जहां पर दिक्कत आ रही है, हमारे पूरी सप्लाई चेन में जो लोग लगे हुए हैं, बड़े उत्साह से लोगों तक ये आवश्यक चीज वस्तुएं पहुंचा रहे हैं.
To stop the spread of coronavirus, it is being ensured that social distancing is maintained by people while they purchase vegetables and fruits at various Safal stores.
साफ सफाई का पूरा ध्यान रखा जाता है, साथ में जो तो सोशल डिस्टेंसिंग का भी पूरा ध्यान रखते हैं और पूरी कोशिश रहती है अपने सफल टीम की कि उनको ग्राहकों को ताज़ा फल और सब्जी सुरक्षित और ताज़ा प्राप्त हो.
Consumers are as always satisfied at the quality and price of fruits and vegetables.
सफल में आने का एक ये बहुत फ़ायदा है कि यहाँ पे हमेशा सब्जी ताज़ी और अच्छी मिलती है. कंपैरेटिवली रेट भी बहुत अच्छे हैं मार्केट के अकॉर्डिंग. तो सफल में आने का और लॉकडाउन के बावजूद भी सफल आपको हमें एकदम ताज़ी सब्जियाँ प्रोवाइड करवा रहा है.
After cleaning fruits and vegetables at Mangolpuri plant, depending on the demand at the morning and evening outlets, fresh fruits and vegetables are supplied to 310 retail outlets in various areas of Delhi NCR. Safal's team of nearly 800 people is performing its duty with utmost sincerity, and it is due to their efforts that fresh fruits and vegetables are being made available on time in various parts of Delhi NCR. With inputs from Urmilesh Bhatt, Newsnight Desk, DD India.
Well, responding to a call by Prime Minister Narendra Modi, the 22 central and All India Services Associations and state associations too have joined hands together on a common IT-enabled permanent solution platform. It's called Karuna, and they'll support and supplement the efforts made by the central and state governments in fighting COVID pandemic. Around 10% of the members currently in CC WhatsApp group Slack platform. They are in critical positions in government and also leading relief efforts in their departments and their fields from across the country. So this group played a key role in removing bottlenecks in key areas such as procurement of ventilators, distribution of ration kits, shelter to migrant workers, relief to over 4,000 families. All this has been organized so far by Karuna team. And the informal association networks are engaging, they are exchanging real-time bottlenecks, the problems with those bottlenecks, their association members, which these are being shared either by WhatsApp or by Slack, and also the corrective action due to the vast human capital in this group. It's being harnessed and they're providing solutions in the field to field functionaries as well. The Karuna online architecture works through the creation of various work groups. There are 6 immediate response groups functioning on Karuna. These are migration shelter, migration food logistics, migration medicine logistics, healthcare PPE logistics, healthcare masks, healthcare ventilators, IGOT health, and each channel is headed by a member of Karuna. They are called the leads, and they have about 4 to 5 crore members, in fact, in support all across the country, working from home purely on voluntary basis. It's a great camaraderie. They ideate, they identify, they anticipate issues relating to their work groups completely without any hierarchies and without any service boundaries as well. Moving on to our next story, the Railway Ministry has clarified that regarding certain stories in the section of the media which is about new protocols in the railway passengers that would have to be followed once the services are restored. Now, it may be brought to the notice of all concerned that the Railway Ministry has not issued any protocol as yet, as falsely mentioned in this report. It is premature to speculate about the norms of the railway travel by passengers at this stage. Railways would take a best feasible decision in the interest of all stakeholders, including prospective passengers. All concerned are requested not to be guided by rumors or misleading reports in some sections of the media. All concerned would be intimated about the same, and when this decision is taken, they will be intimated about it.
रेलों को फिर से चलाने से संबंधित किसी भी विषय पर कोई भी जानकारी कि ट्रेन कब चलेंगी, कैसे चलेंगी, किस प्रकार से चलेंगी, इस विषय पर मीडिया से और जनता से आग्रह है कि इधर-उधर की जानकारी की तरफ ना जाएं, कुछ गलत खबरों पर ध्यान ना दें। सरकार, भारत सरकार जब भी फैसला करेगी, यथोचित फैसला करेगी, सबके हितों को ध्यान में रख के फैसला करेगी और इस विषय पर जब भी जानकारी देनी हो कि समय अनुसार सबको दे दी जाएगी।
And Taiwan's foreign ministry on Thursday strongly protested accusations from the head of the World Health Organization that the self-governing island was linked to and condoned racist personal attacks on him. Ministry statement expressed strong dissatisfaction and a high degree of regret and requested that he immediately correct unfounded allegations immediately and clarify and apologize.
Without any verification, Director General Tedros Adhanom has made groundless and false accusations against Taiwan. Not only do they not represent reality, they have also caused severe harm to the government and people of our country. This kind of slanderous behavior is highly irresponsible. The Taiwanese government sternly demands that Director General Tedros Adhanom immediately correct those groundless accusations, come clear and apologize to our country.
Meanwhile, at the press briefing, Tedros had vocally defended himself and the United Nations Health Agency's response to the coronavirus pandemic. He gave a strident defense, of his agency's handling of the coronavirus pandemic in response to criticism and a suggestion also that Washington could review its funding of the agency. The WHO Director General Ghebreyesus, that's Tedros Adhanom Ghebreyesus, repeatedly called for unity and a halt to politicization of the global health crisis.
The focus of all political parties should be to save their people. Please don't politicize this virus. We're close to every nation. We're colorblind. We're, what do you call it? Wealth blind. We don't see. For us, rich and poor is the same. For us, weak and strong is the same. The United States and China should come together and fight this dangerous enemy. They should come together to fight it. And the rest of G20 should come together to fight it. And the rest of the world should come together to fight it.
Dr. Tedros was elected with the strong support of China, one of the 5 permanent veto-wielding members of the UN Security Council, and he has firmly backed Beijing's claims to have been open and transparent about the outbreak, despite strong evidence that it suppressed early reports on infections while echoing its criticisms of the United States. Prime Minister Narendra Modi spoke on telephone today with Moon Jae-in, the President of the Republic of Korea. The Prime Minister warmly recalled his visit to the Republic of Korea last year and expressed satisfaction at the increasingly close ties between the two countries. The two leaders discussed COVID-19 global pandemic and the challenges that they posed, that the global pandemic posed to the health systems and economic situation, and they also shared information about the steps taken in their countries to tackle the pandemic. The Prime Minister expressed appreciation for the technology-based response deployed by Korea for managing the crisis. President Moon Jae-in appreciated the way Indian authorities have motivated the vast Indian population for fighting the pandemic with unity of purpose. The Korean president thanked the Prime Minister for the support being provided by Indian authorities to Korean citizens. The Prime Minister expressed appreciation to the ROK government for facilitating supplies and transport of medical equipment being sourced by Indian companies. The two leaders agreed that their experts would continue to consult with each other and to share experiences as they research on COVID-19. Moving on to our next story. Prime Minister Narendra Modi had a telephonic conversation with President Yoweri Kaguta of the Republic of Uganda, and the two leaders discussed the health and economic challenges arising out of COVID-19. The Prime Minister assured President Museveni that India stands in solidarity with its friends in Africa during the present health crisis and would extend all possible support to the Ugandan government's efforts to control the spread of the virus in its territory. The Prime Minister expressed his appreciation for the goodwill and care extended to the Indian diaspora in Uganda by the host government and society, including during the present situation. The Prime Minister warmly recalled his visit to Uganda in July of 2018 and touched on the special nature of India-Ugandan ties. Both leaders shared the hope that the world would soon prevail over the challenge of COVID-19. And with that, we conclude News Night for tonight. Thank you for being with us. Namaskar.